This is a really important discussion. I'm so excited to continue it as we think about addressing the current challenges around food and nutrition security and the important role of research. So, Robin, I'm excited to start with you because you mentioned this concept of a syndemic that is contributing to issues including nutrition insecurity and diet-related diseases. And I'm wondering if you could talk about what this means. I'm especially concerned for the folks watching online that they may not understand this concept of a syndemic.
Sure, thank you, and thank you for having me here. I am wearing the hat of World Farmers Markets Coalition today, and one of the other hats I had worn. I was part of New York State. I'm from New York City. New York statewide Medicaid 1115 waiver works since I guess 2014 through the pandemic 2021, and I just want to start by saying that we have made a tremendous improvement and progress in making food is medicine reality, and I've seen it. I've done the work. We actually invested money to do that. Having said that, I worked in the Bronx area, responsible, caring for something like almost 400,000 people, and this is a place you might have heard of, the Bronx, New York, through the pandemic, especially, where children pre-pandemic were food insecure, 39, almost 40%. So the syndemic, it means two or more epidemics are synergistically interacting to exacerbate the problem at hand, which is the in excess burden of the disease of the population. So, diet-related disease, like almost, I would say almost all our chronic disease problems are diet-related diseases. And then food security and the pandemic, and we've seen that, the multiple interaction among those three things and how it made things so much worse for some people, not others. So that's what syndemic means. So I just want to make a couple of points about the food as medicine. A lot of great things that are said today. I do want to caution the going forward, I recommend that we need to focus more on making sure that the food as medicine is equity-centered, because that is an assumption, and that is something not to be taken for granted. And also, if our assumption is, if these people just get a little more produce, they will be healthier, I would say that we're at a risk of reductionist, atomistic approach, even a little arrogant, I might say, because I've seen how hard behavior change is. For human, it's absolutely, they need the access to the better food, healthier food. But for us to say right choice, as in somebody's making a wrong choice, or there's a right food, smart choice, as in somebody's making a dumb choice, that kind of value judgment will get in the way and hamper our effort to help those population, individuals in the population and families change their behavior, and that takes a longer time.
It's so important to talk about the semantics, the language, the vocabulary of all this, and I think we all get sort of caught up and not understanding. So if I can turn to you, Lauren, semantics are obviously important, but you're seeing a lot of these things sort of intersect with your work. At the Greater Boston Food Bank, you saw how the pandemic, syndemic, all of these things are affecting people. The right and wrong judgments that often get placed on people, these are all things that you have to interact with on a daily basis.
Yeah, so that's right. So people ask, why as a doctor at the Greater Boston Food Bank, and why would I ever say, yes, I'll be there one day a week in a warehouse of food? So the amazing thing about this food bank is that there's 30% to 40% what we send out to our distributors is produce. So that was really exciting to me. But the other part of this is that all food pantries, we try to have client choice so that people can choose their options. And yes, we mostly distribute nutritious foods, but we're not saying this is right and this is wrong. We want to give them dignity, and we know that going to a food pantry is difficult. The other thing that I would say that I love about this network, right? There's 600 distribution sites in Eastern Massachusetts that we serve, who serve 600,000 people. And I think the other panelists have said this before, but they really know the community, and they really value them, and they know their stories, and we want those stories to be lifted and part of the solution. We don't want to prescribe that for them. We want to hear it from them directly.
Absolutely critical to this, and we've been hearing it all day. Storytelling, equity-centered, community-centered, all of these things really need to happen. Kim, I want to take a step back, if we could, and talk about how we got here, because I don't think I understand it, and I went to this school. Why have our public health systems ignored food and nutrition for so long?
Thanks so much. I want to say it's just amazing to be here. It's really an honor, and it's been such an energizing conversation so far. And I think, that's just such an important question. I think that it goes back a little bit to what Robin was talking about, that we really all have a huge role to play in increasing the understanding that these issues, these inequities and health outcomes that we're seeing, and the huge burden of poor health outcomes that we're seeing is really about policies and systems and not about personal failings. And when we can understand that, we can really look at what are the solutions that we need. And that's part of why I think, looking at that bottom of the pyramid is really so important in terms of the food as medicine opportunities. Is so important to keep at the foreground of this conversation. Like, we really need to be recognizing how crucial having the strong and having strong and huge amounts of access to programs like SNAP, like WIC, Child and Adult Care and Feeding Program that we know work is really the foundation that we're going to build upon for continuing to make these kinds of changes in the future. And really recognizing that while there's huge opportunities in the health systems and more like proximal to those ultimate health outcomes, we can't leave behind, when we're having this conversation, we're feeling this momentum, those more foundational policies and systems that are actually really driving how we got here. And so I think, part of why those policies and systems are not as effective as they could be is because we've let them be fragmented, and we haven't built that shared understanding around how foundational they really are to the outcomes that we all need and we all deserve.
I mean, that's so well said, but I think a lot of us don't get why these silos were created in the first place. And so I'm wondering from all of you how we break those silos. And I know it's a very simple question. We've been talking about it all day, but how do you each individually in your own work try to do that? Lauren, do you want to go first?
Yeah, so I wear two hats. I'm a pediatrician at Mass General, and I'm also at the Greater Boston Food Bank. And so in it myself, I'm joining these two worlds, the community and the clinical piece, and trying to do it. But we also wrote an editorial in the Globe yesterday, Catherine D'Amato, our CEO, and myself, to say at least in Massachusetts, we should have an office of food security so that we can all work together so that these siloed systems can be brought together. And there's been many conversations of cities doing this, but at least as a state, as a leader in this area, we could start there.
Thank you. Robin?
I would add to that. The system is working exactly how it's designed. Mm-hmm. So silos system isn't broken, it's working fine. It's been designed to be too efficient. I know Dari, to start us off, to talked about our, I guess, green revolution. I will put the name there, but we got way too efficient, and it's really a balance between efficiency and effectiveness. And I think a lot of us mean efficiency when we actually say effective. And it's not to blame anybody here. We're so used to the way things are running. So I think it's really important to acknowledge that system is working as it's designed. Right. And something for the silos to be broken, something's got to give. And what is that thing that's going to be given up is something we need to figure out.
Robin's talking about revolution. I like it. Kim, what silos do you break in your own work?
I think this is a place, actually, cities have been really at the forefront of doing this for some time, and we've seen really over the last decade, cities kind of take the lead, I would say, in recognizing how cross-cutting food is and how much opportunity there is for change when we do kind of work together across silos. So in New York City and here in Boston, as we were just hearing about, are two of the localities that have had mayor's offices have kind of dedicated offices and point people that are trying to coordinate across city agencies and really do those experiments, do those tests, do that coordination that can show how we can have a more kind of integrated and holistic and effective approach. It's not nearly effective enough because we still have so many challenges, but we have many examples of collaboration, and just one I can highlight is we have a recent new program where we are coordinating with our public hospital network to try and bridge that affordability gap. You know, there's been a lot of conversation about how much of this is driven by inequities, and we heard about income inequality, and we really need to also think about wealth inequality as even more kind of foundational. And so recognizing that, you know, one of those really probably the largest barrier to healthy eating is affordability. There's programs that thankfully happening at the federal level, like the GusNIT program that we should all celebrate and see as a major path breaker in terms of supporting nutrition security. But locally, you know, we're looking at this new program that's for folks who may not have access to other programs, and looking at providing credits to people so that they can order groceries from a network of New York City stores and have those groceries home delivered if necessary. And the criteria for the program is being at risk of food insecurity, having reported a diagnosis of hypertension or diabetes, and being a member of our NYC Care program, which is a health access program that's run through our public hospital network. And so it's the program's run in the health department, but a lot of the referrals are coming through our public hospital network, and it's kind of recognizing the systemic barrier of affordability, and we're really looking forward to evaluating that and seeing what we can learn about, you know, making resources more readily available to people and how it can impact health.
That's so
Can I
exciting.
add
Go ahead,
one
Rob.
more thing about silos between research community and the community? The other hat I wear, I'm a senior advisor to Robert Wood Johnson Foundation's one of their signature program called Interdisciplinary Research Leaders. That's literally bringing interdisciplinary research into the community. It's community-engaged research. It's really hard to do. There's inherent power dynamics, differentials. So the money, you know, research funding that's invested in the research and researchers must translate down to the community and disseminate in the language. And I don't mean English, Spanish, but that too. But you know, language and language level that they understand, and really get it down to the ground. And somebody says "see" to society. That needs to happen from the community, and that doesn't always happen as we think it should. So that's another silo that we can break.
Absolutely. The ground up has to really happen. So Lauren and Kim, if I can switch gears and talk to you both a little bit. Earlier on today, we talked about mental health and diet and nutrition and food insecurity and nutrition insecurity. And I'm wondering if you can both sort of touch on how food and nutrition really impact mental health. And it happens in a lot of different ways, whether it's about access and affordability or, you know, actually what nutrients you're able to get.
Yeah, so we just released our third annual statewide survey on food insecurity in Massachusetts. And so what we found in that, this is the first time we asked about chronic medical conditions. And so we found 1 in 3 adults were food insecure in Massachusetts. Also 1 in 3 children are experiencing child level food insecurity, which as a pediatrician is horrifying and saddening. But what was very interesting, looking at chronic medical conditions, those who were food insecure had depression and anxiety rates that were double. These are 56-60%, and the general population, what we found in the survey was 30%. So I don't know if it's a chicken or an egg. I think you're worried about putting food on the table for your kids. You're going to have a lot of anxiety and depression. Being a parent, I have 2 young children, is hard, and then to worry about are you going to provide enough food for them is extremely hard. So I think there is this chicken and egg cycle.
Yeah. Kim, do you want to touch on that?
Yeah, I think we have similar results. We have an annual survey that we conduct in New York City, and we see increased associations between people at risk of food insecurity and diabetes and hypertension, but also depression. And so I think one of the things we want to evaluate in the program I was just mentioning, Groceries to Go, is asking people, there'll be a survey before and after participation in the program, and getting at some mental health indicators, but also financial stress and general stress, and seeing if the program helps to alleviate that, in addition to things like fruit and vegetable consumption, or at the aggregate level, some of the health outcomes that we'll have access to. And I think that's really critical to understand, and we need to think about food as medicine in that, with that kind of broader application. You know, when we might be looking at some of these really clinical factors, and we need to think about things like financial stress and the sort of reality of people's daily lives and how they connect to health in designing the interventions and in designing the evaluations as well.
So smart, thank you. I'm wondering, when we're talking about research and how it needs to be funded, which we've touched on a lot here today, why does it matter where funding comes from, or how food as medicine is actually framed, or food as health, or all of the other terms we've heard today? Why does that matter when we're talking about this topic?
It's not either or, it's both and. Like Dari and others mentioned, when it's a critical need for the patient to have better nutrition, medically tailored meals are absolutely necessary. But a lot of the people we know who are what we call food insecure are not necessarily dying yet, and they have their other priorities. So they might be making the smartest choice they can make, which is to buy what they buy. So in that scenario, food is medicine. Like I don't like to take medicine. Nobody likes medicine, and food is more than medicine. Food is your identity. Food is your culture. So framing it broadly, again, it's not to say, food is medicine works, but putting in the context, it's almost sometimes irrelevant that the food is medicine approach works, because we have to think about the context.
Kim, you were nodding.
Well, I'm agreeing with everything that Robin says. I think it really is some of the issues of equity that she's mentioning, so that we really are not being too narrow when we think about this, and recognizing that context. What really are the barriers that people are facing, and how are those being considered in, what's possible for food as medicine interventions, what investments we're going to make. And when we think about research, we need to look at the people with the most barriers, not the least barriers, in terms of assessing effectiveness.
Lauren?
Yeah, I would say the infrastructure for that community-based organization, when you are doing research with them, is so important, right? So we wanted to do more data-driven methods at the food bank. Some of our food pantries only were taking their data on index cards, and others had really sophisticated Google drives, et cetera, or like Google systems to get delivery to them via a text message. So really investing in those smaller CBOs and giving them the tools so that they can participate, so we can understand the barriers of everyone. It's important.
Yeah, totally important. Thank you so much. So I've heard a lot today from people like Dr. Ojikutu earlier, from Kim, you said this on our prep call, that there is a lot of focus on the small changes that need to happen to get where we need to go. But we also need, it goes back to revolution, we need a big systems change. So how do we get there? And that's my last question. So we can spend a few minutes on it. Kim.
I'm gonna echo the storytelling and really the organizing. I mean, part of today, like what I see, is the success of organizing, and we've had some successes, but the scale is too small and too slow for what we really need. We have to, be bold in saying how unacceptable our current realities are, and we need to organize together to demand a more accelerated change. And so everyone in this room is doing that, but tell everyone else that we need to do it, and do it faster, I think.
I agree, and this is where I actually wear the Farmers Markets Coalition hat. Behavior change does not happen in a vacuum. It happens in a community with people you trust, and you must like what you eat. It's not enough that you should be eating the right thing, a healthier thing. You have to like it, and that takes time, and that happens in the community. If you, as my friend, try arugula that I hate, I'm gonna want to try it. maybe try twice, 3 times, 5 times, and maybe I'll end up liking it. This is a small example of how things change. My behavior and everybody's behavior changes in the community.
Thank you, Lauren.
Yeah, so I think this unacceptable 1 in 3 people in Massachusetts being food insecure is just really unacceptable, and I think we all need to work together. I know there are for-profits in here, I know there are nonprofits in here, I know there's public sector and private sector, and so I think we all have to, this is a human right issue for people to have food, and so I think we all have to work together to create solutions, so.
It is a human rights issue. This is also what I heard, be bold. The current reality is unacceptable. I can't reiterate that enough. Do it faster and like what you eat. Thank you so much to this panel.